Hello, my name is Emily Beckman, and my nursing colleagues Suzanne Kreger, Melanie Escartin, and Lora Garrett and I will be presenting to pass House Bill 267. House Bill 267 will ban anyone under the age of 18 from buying, using, and possessing e-cigarettes. E-cigarettes have become an increasingly popular way to inhale nicotine. Unlike traditional cigarettes, however, Kentucky has no laws prohibiting minors to buy and use e-cigarettes. Although e-cigarettes are being marketed as a safe alternative compared to traditional cigarettes, this is not the case. Marketing towards adolescents, lack of regulation, and harmful physiologic effects will do more harm than good.
E-cigarettes have been the target of many recent marketing schemes that are extremely disturbing on an ethical and social level. Over 40 years ago, big tobacco companies were banned from marketing to youth through the television, radio, and billboards. Since then, great strides have been taken in America by implementing smoking bans over many states. However, the producers of electronic cigarettes are now using those exact same marketing schemes to reach the youth of another generation with tobacco. E-cigarettes are marketed as pleasurable for youth and appeal with different flavors. For example, one of the main e-cigarette company ads boasts, "It's the most satisfying way to tell the smoking bans to kiss off. Okay, maybe the second most," as it shows a picture of a woman holding up her middle finger to the camera. Due to this direct marketing to youth, a vaping subculture is rapidly developing in America, and e-cigarette users come together for festivals known as Vape Fest. Because of this, as well as many other reasons, health organizations view electronic cigarettes as a gateway drug that encourages youth to experiment with harder drugs, or traditional cigarettes at least. E-cigarettes are also being marketed to America's youth as safe, and studies show that youth that perceive that electronic cigarettes are less harmful than normal cigarettes are more likely to report using them, or at least experimenting with them regardless of their baseline smoking status. Statistically, researchers have found that 11.9% of former smokers and 2.9% of previous non-smokers have tried e-cigarettes. This means e-cigarettes are not only being used by current smokers, but are actually exposing previous non-smokers and former smokers to these products, also making them at higher risk for using traditional cigarettes.
Another criticism of electronic cigarettes is the lack of regulatory oversight and quality control measures. E-cigarettes are currently classified as electronic nicotine delivery systems, or ENDS. The World Health Organization suggested that ENDS products be regulated as combination drug and medical devices. As a result, Australia and Canada have banned ENDS pending review by regulatory agencies. Here in the U.S., a court ruling in 2009 stopped the Food and Drug Administration from regulating ENDS unless they are marketed as tobacco products or smoking cessation aids. Unfortunately, many e-cigarette products fall outside of these categories, posing a significant challenge to regulation and offering few barriers to access to minors. Without the necessary regulatory oversight, quality control measures and standardization of the product are largely absent. The Center for Tobacco Products conducted research that found varying levels of nicotine in the flavored cartridges marketed by e-cigarette companies. Those levels ranged from 0 to more than 24 milligrams. Additionally, research by the FDA demonstrated substantial variations in the contents of 18 varieties of ENDS cartridges. Several contain nitrosamines, tobacco-specific products known to cause cancer. They also discovered varying degrees of nicotine levels, including some cartridges advertised as not containing nicotine that actually did.
As you have heard from my fellow nurses, while the marketing towards our youth and the lack of regulations on the components and contents of e-cigarettes are reason enough to support the proposed ban to minors, I would like to add one more reason: the unknown long-term consequences. The existing research on the effects of e-cigarette use is far outweighed by the research yet to be done. What we do know is that nicotine is a highly addictive substance. It stimulates special receptors in the brain, which produces both euphoric and sedative effects. This alone may entice adolescents and teenagers who already struggle with emotional issues or attention deficit to try e-cigs, even if they never smoked. The effects of vaping and secondhand vaping is currently under research. What is already known is that the short-term effect of direct e-cigarette use shows the same negative effects on the lungs as seen with smoking tobacco. And in direct contradiction to the advertisement, e-cigarettes are not emission-free. Preliminary research shows several brands not only emit residual nicotine, but also formaldehyde, acetylide, and acrolein, which are known to cause cancer. Serving as a nurse in the state of Kentucky for the past 15 years, I routinely work with patients who are suffering from the consequences of smoking. Now in their 60s and 70s, these patients were in their teens and 20s when the Surgeon General released his landmark report 50 years ago this year on the dangers of smoking. By the time his report was released, many of these patients were already addicted to nicotine. Of those who did stop smoking, many now live daily with the consequences of smoking those few short years in their teens before the long-term effects were known. Additionally, for every patient alive struggling with chronic bronchitis, emphysema, pulmonary fibrosis, asthma, cardiovascular disease, and lung cancer, 3 or more have died from these disparities. With the long-term consequences of the use of e-cigarettes being markedly unknown, please let us not repeat this tragedy. Let us not undo what it has taken 50 years to accomplish. Let us not re-glamorize smoking. In conclusion, we would like to thank each one of you for your time today and for your support in protecting the health of our youth by voting for the ban against the sale of e-cigarettes to minors.